Hello everybody, and thank you for that lovely warm welcome. I'd like to also acknowledge the traditional owners of this land, the Yagamba people, and pay my respects to their elders, past, present and emerging. Congratulations on a fantastic conference program and a fantastic conference theme. I couldn't resist just paraphrasing for myself where to next, because I want us to keep our eye on the ball of an eye on the prize of improved mental health and wellbeing for our children and young people. Now, I just have to check that I know how to do this. Whoa, I've now killed it. Okay. Look, we know the last thing we need is another report. We know we've got all the information that we need, really. We know the system's been broken for a long time. And there are now a lot of reports really, I guess, highlighting where we need to go. It's a matter of the will to put these into action. COVID restrictions and lockdowns have been a game changer and forced us to recognise that mental health is a core element of our everyday life every single day. We cannot unsee what we've all experienced. Hopefully, this shared experience will bring greater understanding and compassion, as well as greater policy precision to preventing and responding to mental ill health. Turning back is not an option. In what's been called a plan-demic, we now have all these national strategies currently under development. Unfortunately, they're being developed in their silos, as is the way government works, but it is in the gaps between those silos, the gaps between the plans, where I see that real transformation is possible. That's where the opportunities are, but there are many risks. Just a moment on child suicide. This was one of the most shocking things for me as I came into this role before Christmas, was to learn about the prevalence of child suicide, such a deeply distressing topic, but also the disparities between Indigenous and non-Indigenous children. These disparities also surface in other areas, such as the other symptoms, I should say, such as the overrepresentation in out-of-home care and in the youth justice systems. And this is just simply unacceptable. And I just don't understand, I would say that honestly to you, why in this country we accept this. We need to stop accommodating the dysfunction and the problems and the crises that are out there when it comes to our kids, and we should be expecting governments to be doing more. During COVID, we saw mental health amplified, especially for the very young.
We don't have access to services. You can't go somewhere because waiting lists are too long.
Everything is gone. There's no school, no park, no friends.
With anxiety and depression, you're left alone with your thoughts. It's harder to tell your friends over text that you're struggling with things, as opposed to in person.
So Kids Helpline saw a 38% increase in first-time users last year, as well as the usage by 5 to 12-year-olds doubling. Even before COVID, we knew that kids were worried. And from the longitudinal study of Australia's children, we know they worried most about their families, their parents, and they worried. The ones in disadvantaged communities also worried about more things, especially about their families. But when we asked them where did they turn to for help, they turned to their families and their friends ahead of mental health professionals or even the internet. So family is very important. There is a connection between kids and the mental health and well-being of their parents. Again, not often talked about. The family lens is often missing in the siloed way that our services are constructed. So we always need to remember the interdependence between parental and child mental health. Children are also connected to the neighbourhood, the conditions under which they're living, and the housing and financial circumstances of their families. So all of these things are factors that have a direct connection to the mental health of our young people. And there's much that we can do there. I haven't got time to talk about it, but the Right at Home randomised controlled trial led by Professor Goldfeld really reinforces the value of investing in intensive home visiting early on in life for the mother, but also for the children in the long run. Currently, we're failing to create the conditions that enable our children to live well. We have a patchy landscape, and we're particularly poor in remote and regional areas. Frankly, it's a lottery where you're born as to what you get. And the absence of the services that are needed and the qualified professionals that are needed has led to a shocking situation where the criminal justice system is often the response for Indigenous children who are actually in need of mental health support. Much of what we do in policy terms currently is trying to address the symptoms, not the root causes such as poverty, discrimination, or disadvantage. We've been unable to shift investment upstream, and right now we're continuing to pay much more for late reaction policies. And best we can often do is the ambulances at the bottom of the cliff. Australia ranks only 32nd out of 40 OECD countries on child wellbeing. Why are these not headlines in our national media? Tomorrow, Professor Oberkleide's going to talk in detail about the new National Strategy for Child Mental Health and Wellbeing. This is a landmark plan, and it's worth paying close attention to it. I just wanted to mention it in terms of it recommending that we have a wellbeing, an approach to it that is more of a continuum, that focuses on functioning rather than diagnosis, that looks at kids either being healthy or coping or struggling or unwell. So a continuum idea which really helps us to see where we can intervene, either to prevent mental ill health or in fact to intervene effectively as early as we can, far before we get to the unwell stage. And I think that sort of wellbeing continuum for me really opens up an opportunity at the policy level. You know, if you think back to those siloed plans I showed earlier, you know, about where those plans should be working well together to say, okay, here's where we should be paying attention to the wellbeing of kids. This is where we're going to get the best effects. I fear that many of us have become accustomed to children not being a national priority. For too long, children and young people have been seen as a soft area of policy or a private matter for families. And we don't acknowledge this is really complex, right? That economic and social policy go hand in hand, and that all of us benefit from our governments paying attention to our wellbeing, especially those children living with disadvantage. We know that mental ill health, child protection, youth crime, and family, domestic and sexual violence share many common underlying factors, yet we continue to try to deal with these as separate symptoms in separate policy silos. This iconic image is very well known. The economist Mariana Mazzucato has written a book called Mission Economy, where she looks at how they got there. So unlikely in the 1960s, so complex, so expensive, and they did it, right? But she uses this as an analogy for us to solve our most complex problems today. And instead of just accommodating our current problems, often driven by poor governance, frankly, we need to be aiming higher, not just tackling symptoms, but tackling root causes and focusing on the outcomes we want to achieve. We need to imagine a better future and setting goals, reimagining the role of government and strengthening our systems, transforming our systems where needed, the health and education systems in particular. COVID has shown us what national coordination can achieve, Now we need national oversight at cabinet level. We need a minister for children and young people. We need that kind of mission commitment. This is her book if you're interested. Currently, adults take centre stage when it comes to policy, and children are on the periphery. Rarely do we see children's perspectives make it into policy design. We need to listen more to what children and young people say they need and to act on what they say when designing policy. We should not accept children as a low priority. We need to build a culture that recognises childhood as a uniquely important stage of life. We need to expect governments to do whatever it takes to create the conditions that promote the development and well-being of our children and the families that are supporting them, and that values and respects children in the here and now. National coordination has shown us what's possible during COVID. We've had online and telehealth, schools and workplaces doing more for mental health, more funding. You know, these are positive developments on which we can now build. With our eyes firmly on the post-COVID decade, we should be asking, what have we learnt and how can we create the system changes that the pandemic has proven are necessary and possible? Coordinated and multi-systemic early action can prevent problems and avoid the tragic human and economic costs escalating. Applying evidence and a human rights perspective and amplifying the voices of children and young people, together we can create the conditions that will promote better mental health and well-being. This conference comes at a time of urgency and change. We need to aim higher and work together across disciplines, sectors and jurisdictions with a shared commitment to the mission of system reform. Thank you very much for inviting me here today, and I wish you all a fantastic conference.